This is Julia Halfiani, and I'm going to be performing my clinical skill of trach care. The first thing I'm going to do is wash my hands and put on a set of clean gloves. I'm going to verify my patient orders against the MAR and gather my supplies, ensure patient privacy, introduce myself to the patient. I'm going to get 2 patient identifiers, the name and the date of birth. I'm going to explain the procedure to my patient that I'm doing trach care, maintaining a patent airway by getting any secretions or backup mucus, cleaning them up. The first thing I'm going to do is put a pulse oximeter on their finger. If there's provider's orders, I'm going to hyperventilate the patient and adjust the ventilator. The first thing I'm going to do is turn on the suction device to 150 mmHg max. Gonna occlude the catheter to make sure it's on. Now that everything's working, I'm ready to prepare to do my suction. Going to get my suction catheter kit. I'm going to open it. This is going to be a sterile procedure. So I'm going to sterile field. It's going to be over here. Got my sterile gloves ready and my solution. Everything is on the sterile field right next to me. I'm going to pour the solution in first. Keep the cap off. And now I'm ready to put my sterile gloves on. I'm going to take these gloves off and wash my hands. I'm going to put my sterile gloves on. Once I have my sterile gloves on, I am going to get my suction with my dominant hand, have my suction device, and I'm going to, with my left hand, I'm going to attach it. So I have the suction in my right hand, dominant hand, non-dominant hand. I'm going to coil it just to prevent any type of contamination. Now, before we want to suction, we want to make sure that it's working. So in my sterile solution, I'm going to suction it to make sure everything's great. It's working. So I'm ready to suction my patient. I'm going to insert it until I meet resistance. Once I have some resistance, I'm going to pull back 1 to 2 centimeters, and then you suction for about 15 seconds. Now, if you need to do it again, you need to wait 15 to 30 seconds before doing that. Also, with my left hand is going to be depressing this to make sure that the suction is working with my thumb. Once that's good to go, it's all suctioned. Dispose of my tubing. Throw it away. I'm going to throw away all my supplies that I just used in the biohazard. Keep my saline on my side because I'm going to need that again. Everything's thrown away. So I'm going to take off my sterile gloves because we are going to now clean the cannula and the trach site. Throw those away, clean my hands, put on a fresh set of gloves. These have been used several times, so bear with me, they're getting hard to put on. Okay, I got clean hands, clean gloves. I'm going to get my care kit. We are going to, once again, set up a sterile field. I have my sterile gloves, all my supplies, my gauze, my dressing, my cleaner, cotton tip applicators. I want to pour the saline in my trays. Keep the lid off. Now I'm ready to put my sterile gloves on, throw these away, put them in the biohazard. Fresh set of new sterile gloving. Sorry, my fingers are really small and it's hard to make these fit. Okay. Those are all set. Main sterile technique. You can push push it down like that. Okay, so we are going to clean the inner cannula and just touching the outer edge. I'm gonna grab it and I'm gonna soak it in my solution. Then I'm going to grab my cleaner and clean the inside. This doesn't fit, but I would be sticking this through all the way through on each side, cleaning the outside as well. Then I'm gonna take my sterile solution, I'm gonna rinse it again, pour it over it. Once it's all clean, only touching the outer part, I'm going to insert it back in. Okay, now, if it was a disposable one, I would do something similar, a little less cleaning, only touching the outer, take it out, inspect it for any secretions or anything, throw it away, get a new one. The locks are different, so make sure you unlock it and secure it and then put it back in, lock it in the correct way. I'm gonna replace the oxygen now, once I replace and have cleaned everything out, back to the provider's orders. Now I wanna clean the dressing and the site. So I would remove the old dressing that would be underneath here, and I would get some gauze, dip it in my solution, clean around the trach plate, all around there. Now for the stoma, you want to get a cotton tip applicator, starting from the inner, going outward in a circular motion, getting all up in there and cleaning it good. Biohazard, a clean dry gauze, and you're gonna pat it dry gently. Now I would put a new dressing underneath and secure it. So once the dressing is removed and it's all clean, I'm gonna wanna secure the tubing. So secure it down. I would have new ties, I don't have any right now. You would put the ties over the old one just to make sure that the trach tube is secure. The narrow end, putting them through each side. Secure it tight with Velcro, but you wanna make sure that there's 2 finger widths for enough slack for the patient so they're comfortable. So now I'm done with my trach care. I'm going to throw all my supplies away, take off my sterile gloves, throw them away in the biohazard as well. Clean my hands, put on some new gloves. And I'm going to cap my saline solution. Date it, put it away. All my supplies are thrown away. Make sure my patient is comfortable and safe. Everything's within reach. And then take off my gloves. I'm gonna document the care. The color of the mucus, if there any blood, the consistency. Document all that. Make sure the patient's all comfortable and everything. And then for my pie, the problem was there was mucus backup and then have clear breath sounds because it was all stuck in there. So the intervention was to suction the mucus, get a patent airway, clean them up to prevent any backup, and then the evaluation, I checked their breath sounds, they had a productive cough, and they're all cleaned up, and I am done with my trach skill.